Typical follow-up for a patient, is particularly an elderly patient who is going to receive daratumumab is standard. It's usually at least monthly, but perhaps a little bit more frequently the first couple of months. Generally speaking, nowadays we would be looking for very deep responses with this regimen, particularly looking to see if MRD negativity can be obtained, which is the case in about 25% of patients on the MAIA study who underwent this regimen became MRD negative. That can be tested in two ways, either by flow cytometry or by sending out the test for next generation sequencing. For patients who progress after a daratumumab-containing regimen, this is an area where we really don't have a lot of good data at this time. Obviously, if the drug has been stopped, it could be restarted, and there's lots of evidence to use daratumumab in combination with either bortezomib, lenalidomide, or pomalidomide at first relapse. Other alternatives might be switching to a different monoclonal antibody. We just don't have good data yet on use of drugs like elotuzumab in this setting, or using a non-monoclonal antibody containing regimen such as carfilzomib in combination with lenalidomide and pomalidomide, or reusing bortezomib again as a second line. Although daratumumab is a very potent and effective drug in combination, one has to remember that it does require a weekly intravenous infusion, and that may not be suitable for all elderly patients where a more oral-based regimen might be appropriate. The company that's developed daratumumab is now significantly engaged in trying to make a more convenient schedule, particularly exploring the use of subcutaneous daratumumab. And while this is still in the clinical trial phase, I think it will certainly make life a lot easier, particularly for elderly patients who can come in just for a subcutaneous injection as opposed to intravenous delivery. For these transplant-ineligible patients, if we look at what's on the horizon, I certainly think we're quite anxious to see the results of elotuzumab-based phase 3 clinical trials, which should report out soon. We're also interested in how ixazomib with lenalidomide, dexamethasone, and perhaps even in a 4-drug cocktail with lenalidomide, dexamethasone, and daratumumab will perform. The early results look very promising for basically an all-oral regimen with the exception of the daratumumab. So these are two of the new advances in upfront treatment that we're quite excited to see, ixazomib, elotuzumab with and without daratumumab.